guys, welcome back to my channel. My name is Krisha Nicole. So today we're going to be talking about interpreting urinalysis tests. Now in primary care, we do dipstick. And I know when you think dipstick, you're thinking dip the stick in the urine, hold it up next to the bottle with the little diagram on it, and compare the colors. This is 2020. We do not do that. So can we do that? Yes, we can. But we take the dipstick and put it through a little machine that prints out the results. So we have to use technology in this day and age, or we'll be going super slow, and you can't really trust those results because it is, what one person sees, the other person may not see. It is all relative. So the way that I feel like this is important for nurses just in general, regardless of where you work, because you really need to know how to just look at the full picture and really interpret the urinalysis, regardless of whether you are prescribing or not. So I remember this being a bit of a weakness when I was an LPN and the beginning of my RN, experience. And now I'm okay. So one of the first things that my eyes goes to on a urinalysis is the leukocytes. Now, in the pediatric world is where I'm speaking of, but it kind of doesn't matter whether it's pediatrics or not. The leukocytes should be negative in a healthy person. So usually if the leukocytes is around 25, 50, or 75, I don't freak out too much about leukocytes. Especially in pediatrics, but this can also be the case for your adults. Don't think that this cannot be the case. It is poor hygiene. It is understandable when it's pediatrics because young girls are trying to figure out how to really wipe from front to back. If you look at a child or your child and you try to teach them how to wipe from front to back, you'll notice it's like their arms are not long enough. So it's just convenient for them to wipe from back to front, and that's wrong, of course. Also, once a child is potty trained, many parents make the mistake of allowing the child to just go to the bathroom by themselves and never checking behind them. And this is something, as a nurse, I was always really diligent with my daughters who have never had a UTI, thank God, because I always confirm, did you get in all the creases and the crevices? Because a lot of girls will wipe the outside of the labia and they don't get inside. That causes skin irritation, that causes UTIs. So typically when I see leukocytes a little elevated and there's no symptoms, I just have the patient clean really good, drink a lot of water, and repeat in 7 days. If the leukocytes is high, like it should be 0 and or negative. If it's really high, like 500, I tend to think this person has the beginnings of a urinary tract infection. They have some type of rash down there, or they have an STD, and I worry a little bit more about some type of infection going on, some type of something happening down there. So I ask other questions like, is there any burning when you pee, any fever, any lower abdominal pain, all of the urinary symptoms that you expect in a urinary tract infection. And I look at the full picture. The next thing I look at, especially with the leukocytes is 500, is the nitrites. If the nitrites is negative, you can feel slightly confident that there's no urinary tract infection. If the nitrites is positive, you better start antibiotics and diagnose that patient with urinary tract infection, as well as sending urine off for a culture, because you want to make sure, you want to confirm what it is growing in that urinary tract that's causing the infection, regardless of whether they have symptoms or not. If the nitrites is positive, I begin antibiotics and diagnose a urinary tract infection. Sometimes on the culture, very rarely I've seen, the bacteria is not too bad. It's not over 100,000. And in that case, I will go ahead and stop the antibiotic. The patient will have had about 3 days of antibiotics, and I'm comfortable with that. If in pediatrics, if it is positive nitrites, I believe the patient has urinary tract infection based on the test, based on the symptoms, then it is 10 days, twice a day, antibiotics. I 99% of the time order Bactrim because it covers so much, and in my demographics, that is what we need to use. Whenever I have searched Hippocrates just to get a little backup, am I really ordering the right antibiotics? Bactrim is what is on there, and you dose Bactrim milligram per kilogram in pediatrics. Okay, so the next thing that I look at is protein. Usually protein gives me some indication of like dehydration. There's something going on with the kidneys. Now in pediatrics, you may not even see ever really any renal disease or renal failure in pediatrics. That is super, super rare. I haven't seen it. So when I see protein that is abnormal, let's say 100, I just repeat in a week if that is the only thing that's abnormal. And I have the patient drink water in that week to see if it's truly just you're not drinking enough water. If I repeat the proteins twice, the urine, twice, and there's protein twice, then I'm just going to send the patient over to the nephrologist. I'm not going to play with it, because if there's something really going on, then I need them to be with the nephrologist. They need to be under a specialist care. Usually it's clear with more water. So that's how I treat the proteins. The next thing that my eyes will go to is ketones. Ketones can be elevated if the patient is dehydrated also, and I typically see the ketones around 15. I don't freak out about ketones of 15. I just have the patient again drink a lot of water, and I typically don't have them repeat unless there's other things that are positive, such as elevated proteins. The next thing that I look at, and there's a list of things on the urinalysis. These are the things that I focus on heavily. So the next thing that I focus on heavily is blood. If there's any blood in the urine, that's just an abnormality that I don't like. So if there's a reason for there to be blood in the urine, I don't freak out. Such as the patient has a urinary tract infection. Well, I assume maybe there's a little blood because of the infection, and it'll go away once I clear the infection. If the pediatric patient is old enough to have a menstrual cycle, I ask them, are you on your cycle? A lot of times the answer is yes, because everything else is normal and there's just blood in the urine. There's no urinary symptoms like fever, dysuria, or polyuria, abdominal pain, none of that. So I just, I worry about blood, but I have to figure out why the blood is there. And if there's blood there, again, just like the proteins, if this is the only thing that is wrong, I will repeat. If it's still blood there, you're going to the nephrologist to just to make sure that they get the testing, the full, bone testing that they need. And that in primary care, yes, I could do, but I'd rather just get them over to the nephrologist and have them, check them out. If a patient has glucose in the urine, I do look at the glucose, because especially in the day and age where obesity is so high in children, I do look at the glucose to just make sure it's nothing. It says normal on the little printout, and on a rare occasion it may be elevated, and typically it is elevated when the patient has type 1 diabetes, and I've only seen it in about 2 patients, and both had diabetes, so and neither were obese. But I don't worry too much about glucose, because it is rare that I see it elevated. I look at it and I just kind of keep going. Another thing that I kind of look at and keep going is specific gravity, because I have not seen specific gravity higher than 1.030, which is okay. And again, I don't have any patients who are in any type of renal disease. Even the diabetic patients, you will see elevated specific gravity in diabetic patients, but the patients that I've seen in pediatrics have had pretty okay specific gravities, and that's primarily because their parents Parents with diabetic kids usually are really on it. They're really focused and they want to make sure they're doing what they're supposed to do for their child. So I haven't seen anybody who was so super dehydrated or in congestive heart failure where the water's not going to the kidneys and it's going other places, so the kidneys are kind of suffering. Haven't seen that. But you do want to keep that in mind in any type of adult care, that those are the reasons why the specific gravity could be elevated. Typically for urinary tract infection, I will order Bactrim. The reason being is because it covers MRSA. It is what kills the urinary tract infection and the demographics where I practice. And also, it is according to Hippocrates, it is what is suggested for urinary tract infection. And I didn't necessarily go by Hippocrates initially. I was thinking ciprofloxacin, and you can even order Keflex for urinary tract infection. Pretty much what you order to take care of a skin infection, you can order for a urinary tract infection. However, I stick to Bactrim at this point. You can also order nitrofurantoin. I can tell you right now, as a nurse practitioner and working with physicians, they rarely order nitrofurantoin. You have to take it too many times a day. You have to take it a little longer. But when looking at an antibiogram for my local area, nitrofurantoin was 100% effective in treating UTI. So if you feel like ordering nitrofurantoin for urinary tract infection, don't feel bad. It is pretty much the provider's choice on what they, for the most part, on what they use to kill a urinary tract infection, to get rid of a urinary tract infection. If you decide I want to stick to nitrofurantoin, you can give it to women who are pregnant, you can give it to kids, and that's what you feel comfortable with. Do whatever you feel comfortable with, as long as the patient is able to pay for it, as long as the patient, you're confident the patient will be compliant with the regimen, and you're confident that it will get rid of the urinary tract infection. Hope you guys found this video very informative. If you have any questions, please put them in the comments below. If there's any other, condition or test you want me to go over, put it in the comments below. Don't forget to like, share, subscribe. See you guys on the next video. Bye.